Factors associated with clinical recovery after concussion in youth ice hockey. So this was a study from Calgary and Edmonton in Canada. These guys do a lot actually with youth hockey out there. So these studies are usually pretty good as well. Youth hockey players between 11 and 17, basically if they had an injury and were suspected of having a concussion, they were given the opportunity to follow up with a sports medicine physician. So this creates a sampling issue because you're allowing people to kind of self-select who's going to go through the process or not. So they're able to follow up with a sport and exercise medicine physician. They underwent SCAT 3 or 5, depending on when it was, and a return to play protocol based on either the fourth or the fifth international consensus statement, along with regular follow-up to determine return to play. Days to clinical recovery was defined as the number of days from the injury to the physician clearance to return to play decision. So they used two models to look at clinical recovery. Model 1 looked at total symptom severity scores, and model 2 looked at scoring of individual symptoms on the symptom severity scores. Each model also considered the number of days to physician visit, so from injury to physician visit, which we know is an important indicator, age, sex, league type, best score, and number of previous concussions. So they had 425 concussions occurred during the period, but they only had 329 players that had data that was complete. They had 366 diagnosed concussions. So obviously there's 37 repeat concussions in there. Median number of days to clearance to return to play was 18. 3/4 of players recovered within 28 days. In model 1, which was the total symptom severity score, time to first physician visit being greater than 7 days and having a higher symptom severity score was associated with longer clinical recovery. This is stuff that kind of fits with exactly the previous literature that's been done in this space, fits with our own data that really the number one predictor is how long it takes you to get in to see a trained clinician. With every 1 unit increase in symptom evaluation score, return to play was increased by 1.016 fold. Age, sex, league type, best, and concussion history were not associated with time to clinical recovery. That's interesting. In model 2, which was looking at individual symptoms, they found that, again, longer time to first physician visit being greater than 7 days, having a headache of moderate or severe status, and having poor tandem stance on the BESS were associated with increased time to clinical recovery. Time to return to play in players who saw the physician greater than 7 days after concussion was 1.6, basically 1.7 times greater than players who saw the physician less than 7 days. Time to return to play in players with moderate severe headache was 1.3 times greater than players with mild or no headache. Age, sex, league type, BESS, and concussion history not associated again with clinical recovery. So this study highlights the importance of early assessment and appropriate management by a clinician after sports-related concussion in youth.